All right, everybody, welcome back. We're continuing with the Advanced EMT series. We're going to go ahead and go into Chapter 3, the workforce wellness and personal safety. All right, so we will be talking about health and wellness in EMS. We're also going to talk briefly about health of the nation. We'll talk about stress. We'll talk about stress that's unique to just EMS. We'll talk about things that can improve your health and wellness, right? So, in order to do that, we got to define what health and wellness is. Health is defined as a state of complete well being, and wellness is the optimal state of living. All right. So, health of a nation. The U.S. Department of Health and Human Services releases this report every 10 years. It's called Healthy People, whatever. The last one was in 2020. Um, the, the, the report identifies health problems and sets goals to improve it. They have four goals. The first one is to obtain high quality, long lives free of disease. The second one is to achieve health equality. The third one is to create social and physical environments that promote good health for all. And then the fourth one is to promote a higher quality of life. There are some risk factors and diseases they look at: obesity, diabetes, high blood pressure, high cholesterol, lack of exercise, and tobacco use. So, in general, as a whole, in the United States, the American people have gotten heavier. Um, some of that's coming from this lack of exercise, um, and it causes the obesity, which will in turn the diabetes, high blood pressure, high cholesterol, all comes out of that. Now we can set and we can put blame on like fast food and technology, but that's not what we're here to do. But just understand that in general, the American people are getting larger. There are some traits or factors that could affect the health and health behaviors. One is genetics, right? Uh, Environment, your cultural beliefs. You ask, well, how does that affect it? How can cultural beliefs affect it? Some cultures don't believe in certain things like modern medicine and so on and so on. So that could affect it, your level of education and your social economic status. All right, moving into um, Andrew uh, Maslow. He created this thing called the Maslow's hierarchy of needs. Basically, what it's saying is your low level needs have to be fulfilled before the higher level needs can be addressed. And the needs listed in lowest to highest is your psychological, which will include uh, adequate food, shelter, sleep, safety, social, esteem, and self accusation, right? These are all the priorities. And here is his pyramid. And of course, the bottom means that's your basic needs, and they have to get fulfilled, or you can't climb that pyramid. Let's look at stress, right? And what is stress? It's the body's response to any type of demand or stressor. And a demand or stressor is a stimuli that produces a stressful response. Now, just remember, not all stress is bad. Sometimes short uh, term stress is good. It helps you focus. It helps you in your performance. This is called E stress. It's EUSTRESS. Some people call it eustress, E-stress, eustress, same thing. Now, if you, on the flip side, if you have long-term exposure to stress, that could have a negative effect on your health and well-being, and that's called distress. That's DISTRESS. Um, when we're in a stressful situation, we have different phases. They call it the general adaptation syndrome or the gas phases. And the first one is alert phase. This is when your body prepares for fight or flight response. It activates your sympathetic system. You release hormones, you release epinephrine, you release cortisol. Now remember, this phase is what kept humans alive years ago. Our ancestors, that's why we're here today. Is back in the caveman days, this phase it activated that fight or flight. Am I gonna, run away from this, or am I gonna stand my ground? In modern society, we don't have that as much, so you'll still get that alert response, but a lot of times your body will return to normal pretty quickly. But remember that epinephrine is still released when this happens. Now, the next phase is called the resistance phase. This is your active coping, and it also does damage repair that's caused by a stressor. And once the stressor is done, or your body's not being stressed anymore, your body will return to normal. The next phase is exhaustion. This is when you have continual stress response that results in the need for rest and recovery. So the only way to get out of this phase is to go into rest and recovery. And rest and recovery is just what it says. Your body's in a rest and it's in recovery to heal damage and stuff like that. Let's talk about timing, stress reactions, and duration. So an acute stress reaction is immediately during or immediately following the exposure to stress, right? This is immediate, or I'm sorry, during the stressor or immediately following. Now, a cumulative stress reaction is repeated exposure to the stress over time. A burnout level is also called exhaustion. It's when the stress continues unabated. So you're just constantly exposed to the stress, and eventually you just get burnt out, or you just get the exhaust rate or phase. Now, post-traumatic stress disorder is a delayed response to an event. This means you saw something stressed you, and then later on you have this response. This became very famous with our soldiers coming back from the Iraq War or the Afghanistan War, but we see it a lot in EMS and fire and police officers. So you're exposed to some big traumatic event, and then later on is when you start responding to it. Um, Here shows some symptoms to cumulative stress and burnout. I'm going to go through all these. These are on your book. You can look at them on your own. So there are some unique stressors that are for EMS, right? So issues with work hours, right? We all know we work long hours. Most of us work at least a 24-hour shift. Sometimes you're working a 48-hour shift. Sometimes there are people that work even longer shifts. So it's your work hours, your workload, right? We all know that call volume has increased and it continues to increase. So those periods of rest aren't there as much as what they used to be. And of course, the pay. Most people in the EMS world think we're the most underpaid profession in healthcare, and you may not be wrong, right? So that is getting better, but it's still not where it should be, according to some people, right? You can have conflict with your coworkers or with your supervisors. Road rage or the other drivers responding to your emergency lights and sirens or lack of can cause you stress. Difficult patients, right? Maybe a combative patient or maybe a child or a dying patient. We'll talk about that here in a minute. And just a general fear of making the wrong decision or making a mistake. And that really will play in as you get into the advanced levels, right? You have more opportunities to make a mistake, and nobody wants to do that. Calls that involve death or dying patients, involves abuse or neglect, involves children, especially children who's sick or injured, right? Nobody likes to see that. And we definitely don't want to see it if it's a combination of the abuse and neglect child, right? MCIs or mass casualty incidents. If we have injury or death of a coworker, uh, and seeing a severe or disfiguring traumatic injury can be very stressful. So, how do you cope with this? How do you manage stress? You have to be competent and prepared, right? You have to use a coping mechanism, and I can't tell you that. That's something you have to figure out yourself. There are different techniques for it. There are some bad ones that we're going to talk about here in a minute, but there are good coping techniques. And at the very end, mental health professionals may have to be called in to help. Um, this is the new ways of thinking is mental health professionals. We used to do CISDs or critical incident stress debriefings, but they're saying due to research that they don't know that they're very effective. So they think that the mental health professionals are a better source. Um, so let's talk about your physical wellness. What affects that, right? Disease and injury prevention, or these are the aspects of it: disease and injury prevention, getting adequate sleep, maintaining a healthy body weight, getting good nutrition, and good fitness. So, some of the risk or challenges that you can be experienced by EMS providers, and we're going to go into detail on each one of these: motor vehicle collision, back injuries, violence, your exposure to communicable diseases, because we all know we're exposed all the time, sleep disruptions, we never have a healthy sleep pattern, lack of healthy food choices while on duty, and long periods of sedentary activity. These are all risk factors or challenges that EMS providers may experience. Motor vehicle collisions, right? Number one cause of severe injury and death uh, among EMS personnel that are on duty is MVC. Going with that, the most common cause of traumatic death for people under 44 are MVCs. So they're pretty serious, right? Um, Back injuries. If you've worked in the EMS long enough, you know somebody or yourself has got a back injury. A lot of EMS workers go to a chiropractor on a normal basis. So back injuries are pretty significant in our line of work, right? We're lifting heavier people that sometimes can or cannot help us. So there's a chance that you could get a back injury in this line. And in order to avoid getting a back injury, it requires proper mechanics and guidelines. I'm going to go through these pretty quick. All right, here's some guidelines for proper lifting technique. This is nothing new. We've been taught this from when we were little kids on up, but we're going to go over them again. We're going to keep your palms up whenever possible. We're going to take our time, position yourself properly. Don't get in a big hurry. You're going to use a wide base, 1 foot slightly in front of the other. You're going to bend at the knees, lower your buttocks, keep your chin up. Work as a team when lifting, right? And one person's going to give the command, and you should figure that out pre-hand. Usually on my ambulance, it's usually me or the highest ranking official usually gives those commands. You're going to inhale and tighten your abdomen. You exhale and use your large muscles and your quads to do the work. And of course, you don't want to turn or twist if all possible. Take short steps if you have to carry someone. Walk forward whenever possible. Keep the load close to the center of your body, so you don't want to have to reach out. Uh, Proper lifting, right? In order to proper lifting, it relies on strength of your arms and your legs, correct posture, good nutrition, and normal body weight. Here's a picture of the correct standing and sitting postures. And moving on to scene safety, right? Every scene has the potential to be violent, and you have the potential to get injured. We call this situation awareness. You have to have a constant situational awareness. Keep your head on the swivel, because even the safest thing can become unsafe at any point. And we know certain scenes automatically out of the gate could be unsafe. Like we get a, a, a call for a psych call or battery call or a shooting. All these we know automatically could be unsafe. So we have the police help us there. But even our routine calls could have a chance to become an unsafe scene. So while you're there, your safety is always priority one. Your coworkers or your partners number two, patients number three, and everybody else number four. We're going to do a good scene size up, right? We're looking for hazards, and we'll go into more detail later on all this. So you're going to do a good scene size up and have your PPE on, right? This is to protect yourself. And you have to have an escape plan. You should always be thinking, okay, if stuff goes sideways, how am I going to get out of here? Now we're going to talk about infectious diseases or, pathogens, communicable diseases, all this stuff. So there are different routes of transmission. Direct route would be direct contact with the patient, either touching them, whatever, direct contact. Indirect is like the patient dropped some blood on the floor or on the cot and didn't get cleaned up, and then you get exposed that way. Respiratory is usually airborne droplets. They're coughing and this airborne droplet, and we breathe it in. And of course, bloodborne, we all know, is that's interaction with the patient's infected blood, either not wearing our PPE or somehow we get a mucal membrane exposure or an not complete intact skin type exposure. The exposure depends on a few things: the dose, how much do we get exposed to, what kind of stuff it is, how long it's been there. All these are all characteristics. These are all in your book. You can go over them. So uh, how can we fight against infectious disease or controls against them? Right, exposure with training and administration. Right, we have good training. We have the bloodborne pathogens every year. Administration, you have a exposure plan. In the engineering control, your workplace controls, and your PPE. Um, Specific measures. One way you can keep yourself, even if you get exposed, is if you're in good health, good general health. Maybe you're good health, so your body immune system could fight this off. You have the proper immunizations to certain things, like Hep B. Every ambulance service out there has to offer that to their employees. It's a 3-shot series, and good proper hand washing. Proper handling of sharps and contaminated items. Of course, we all know the sharps go in a sharps container. Contaminated items go into a bio bag, right? Um, we have to do proper cleaning, disinfecting the ambulance after every call, and you have to be wearing your PPE for your standard precaution. And standard precaution means that we're going to assume any blood or body fluid could be infectious. The most common used PPE is gloves, right? Non-sterile exam gloves used for routine pre-hospital patient contact. They could be vinyl or nitrile. They used to be latex, but over time, even if you're not allergic to latex, over time into exposure to latex, you can develop a latex allergy. Some of our patients have latex allergies, so they've done away with latex and want more vinyl or nitrile. Proper taking off. We all know this. We're not going over this. Hand washing. We know proper hand washing techniques, right? The number one best way to stop the spread or prevent the spread of a communicable disease is proper hand washing. And what if you don't have access to soap and water? We're going to use this alcohol-based gel, which is everywhere now thanks to COVID, right? All your ambulances have it. All the hospitals have it. Or outside the rooms. It's everywhere. So they're at the very minimum, you're going to use this alcohol-based gel hand sanitizer until you can get to soap and water. We're going to keep our nails trimmed and clean, avoid the artificial nails, avoid jewelry that can trap any microorganisms. Or make sure, like if you have a watch on, you're going to cover that up with your gloves. If you're wearing a necklace, maybe you need to clean it up after a call, all this other stuff. Respiratory eye protection and fluid impervious gowns whenever you think there's a chance to come in contact with airborne droplets or any type of blood or bodily fluid could be sprayed. You're going to cover up your respiratory and your eyes. Mask will protect your nose and mouth. We have to place the PPE in proper disposal receptacles, right? So the way they're teaching now is as long as it's not stained with bodily substance or blood, it's okay to put these in the regular rubbish at the hospital. But if they do have blood or a lot of body fluids on it, they should be put in a bio bag and put in the bio bag containers. Exposure occurs when you have some sort of infectious material. It comes in contact with either the mucous membranes or a non-intact skin. So if you have a cut on your hand, you're not wearing gloves, it gets in your eyes or your mouth or in your nose. Uh, One of the things you're going to do if you do get exposure is going to immediately wash that area with soap and water. If it's in your eyes, you're going to irrigate with water or saline. Anything that's contaminated, they have to be either disposed. If it's something you can get rid of, a lot of the stuff on our ambulance is not disposable, like our cots or cot mattresses, our ambulances themselves, some of our equipment, our monitors, stuff like that. So we have to clean and disinfect them. Sterilization, there's not a whole lot in our ambulance that's sterile, other than like the OB kit or something like that. So sterilization doesn't happen as much in our aspect as more at the hospital. Now we're going to talk about sleep and how it affects you, right? Lack of sleep, it just don't affect you. It'll affect your patient because you may not have the best judgment, right? This is where mistakes come in. You may get cranky, irritable, so it'll affect your patient bedside manner, so to speak. It could affect your partner because he's got to work with you and you're all cranky and grouchy, you know, and they may come to the point where they don't want to work with you anymore. Same with the public. You know, you may get snippy or grouchy with like patient's family. When you're driving, you can get road rage. So lack of sleep is not a good thing, right? So they have associated sleep deprivation and making patient care mistakes, significant associated with it. So if you're extremely sleep deprived, you have a higher likelihood of making that patient care mistake. So here's some good techniques to help you with your sleep hygiene or tips for healthier sleeping behaviors. We're going to hit them briefly, like going to bed only when you're sleepy. Makes sense. You know what? You don't go to bed just because it's time to go to bed. And if you're not asleep within 20 minutes, get up, do something quiet that'll make you a little sleepy, like read, right? Don't look at a clock because that never helps. Try to avoid naps throughout the day. I know it's hard to do, and we've been taught from the beginning, the EMS, you should nap when you can because you never know how the night's going to go. But the research is showing that if you're going to do a nap, limit it to an hour or less. Maintain your sleep-wake schedule even on your days off, which means if you're a 12-hour ambulance and you work night shift on your days off, you should continue that pattern. So sleep during the day, be up at night. Don't exercise 4 hours before bedtime. You're going to develop a ritual such as taking a warm bath, um, caffeine-free tea or coffee, uh, and a few minutes of recreational reading, not studying prior to bed, will get you in that sleep mode. Don't use your bedroom for studying, work, or watching TV. Put your phone and tablet away. Avoid caffeine and alcohol 6 hours of bedtime. Don't eat a heavy meal right before bed, although a snack can be very helpful. And make sure your bed's comfortable, right? Comfortable to you because some people like the stiffer bed, some like the softer bed. Try to get your room as dark as possible. Sometimes that don't affect people. Some people can sleep in the middle of the day, sunlight coming in on them. Other people like myself, I have to have it pretty much dark or I can't sleep. Now, going on with that, let's talk about nutrition, right? Healthy nutrition is important. It maintains a normal body mass, maintains the health of your body tissues, and your risk of disease, of many diseases, are uh, lower because of good nutrition. Uh, we can get this information from food labels that tells us about the calories and the nutrient contents. And it says here that the ingredients that are in descending order are amount of food. So the the ones that are on first, there's more in that food. And we all know that working EMS and healthy eating choices aren't always there, or the best choices aren't out there for us. Sometimes we have to eat on the fly. There are healthier um, choices, but sometimes, it takes planning and commitment. Some things, the best things to do is to make your own meals and bring them. Sometimes we don't get the chance to do that. So you're going to do the best you can. You're going to moderate the intake of caffeine and alcohol. We all know that they say that EMS is fueled by caffeine and nicotine. We should start looking into trying to moderate that a little bit. Fitness includes Physical fitness includes healthy body weight. It'll help your muscle strength. So that's always good in our line of work. Makes you more flexible. And it also helps with your cardiovascular endurance. Health and safety tips. Don't use tobacco or expose yourself to secondhand smoke. Like I said earlier, the old adage is that EMS is ran or fueled on nicotine and caffeine. Um, but we all know tobacco has some side effects or some long lasting effects on your health. So if you can avoid it, you should. Use alcohol and caffeine in moderation. No one says drinking alcohol is bad, but you can develop bad habits and it can be bad, especially if you use it to cope. If it's one of your coping mechanisms, that is never a good choice. And you never want to drive or do dangerous tasks under the influence of any substance. They're saying have an annual physical and follow the physician's health screening advice for health screening. And you should see a dentist twice a year for cleaning and examination. So let's look at the other aspects of wellness. You got social wellness, emotional, environmental, spiritual, and occupational. EMS and family life. This can be hard to do, right? There can be a conflict. We all know EMS, a lot of us work a rotating schedule. So if our schedule falls on Christmas, we're working Christmas. You're going to work holidays, you're going to miss, games, pageants, you're going to miss, concerts. You're going to miss a lot of stuff that involved in family, right? This can be um, hard on your family. It has been shown that if you work EMS and then get into a family, it's usually easier, but it still can be very hard on your family. So you have to figure a way to manage all this and to make it work. For your intellectual wellness, we are lifetime learners. You don't just get a license and that's it. That's why we have continuing education. And you should want to have that pursuit of knowledge and keep your skills up to date. To be a good provider, that's what you need to require to be a good provider, right? You need that knowledge and you need that skill set. I was talking about the summary. Let's sum it all up here. Maintaining overall wellness, achieving balance between various aspects of life, and taking actions to minimize work-related injuries and illness are critical to professional and personal satisfaction in our occupation. Areas of wellness will include emotional, environmental, intellectual, occupational, physical, social, and spiritual wellness. Careers in EMS. We have career in EMS possesses particular health risks and challenges, right? MVC, scene hazards, long periods of sedentary activity, long or irregular shifts, frequent heavy lifting, unique stressors, which we talked about, and exposure to communicable diseases. To minimize these risks, you're going to use effective strategies for coping and stressing. You're going to maintain a physical fitness and good nutrition. Receive recommended immunizations. Wear your PPE, right? Make time for friends and family outside of EMS. Engage in personal and professional learning activities. Stay well informed on issues on your health and safety and make good choices for personal health and safety. All right, that will conclude chapter 3. We will see you on chapter 4. Thank you again.